Welcome back to On the Quayside. Today we take a look at a completely different aspect of shipping as we meet National Director of Mercy Ships South Africa, Brenda van Staten. Mercy Ships South Africa is part of Mercy Ships International and one of 16 national offices that manages their hospital ships. These vessels deliver free world-class healthcare services and capacity building to communities. Mercy Ships has worked in more than 55 developing countries, providing services valued at more than 1.7 billion and directly benefiting more than 2.8 million people. Originally from Zimbabwe, Brenda and her family moved to South Africa in 1973. Prior to joining Mercy Ships, she worked as an executive assistant for SAF Marine for 12 years. In July 1996, she joined the MV Anastasia after it had docked in Cape Town for a visit. She served on board for almost 18 years before taking up her current role as National Director for Mercy Ships South Africa. Welcome, Brenda.
Thank you. Thank you so much for having me.
It's great to have someone a little different on the segment. So let's get started. In terms of joining the MV Anastasia, what actually prompted you to do that? I'm intrigued. What was going on in your life at that time? That's quite a major jump.
Yeah. Not much going on in my life at the time, to be honest. I really, though, felt like I wanted to give something back to society. I didn't just want to have a 9-to-5 job 5 days a week. I wanted to do more than that. And as you said, at the time I was working for SAF Marine. I'd been there 12 years, absolutely loved it. They were an amazing organization to work for. So I was very, very happy there. I have a wonderful, close family, and my parents had just retired in Cape Town. And together with my younger sister and her daughter, we got ourselves a big house. And so life was good. But I couldn't ignore this restlessness inside of me to do more than just work 9-to-5, 5 days a week.
And was it a difficult decision? I mean, how old were you at the time? Or should I ask?
You can ask. I was 34 actually at the time. Wow. And, it wasn't a difficult decision. I knew nothing about Mercy Ships. I walked into my church one Sunday morning. There was a team from the Anastasias who were leading the service. And as they were sharing about work on board the ship, I just knew that's what I wanted to do. Dragged my whole family down to the waterfront in the afternoon, toured the ship, cried right through the tour. And then that evening went back to my church and heard Dr. Gary Parker speaking about the medical surgeries on board. Even though I don't have a medical bone in my body, I knew that this was where I wanted to go. So, was it difficult? It wasn't a difficult choice. It was an emotional choice. Leaving my family was difficult, but there was 100% supportive of my going. And it was difficult. I missed out on birthdays and Christmases and births of babies and weddings, but I tried to come home every 18 months, and the reunions were always good. So it wasn't too difficult.
But clearly it was the right choice. I mean, 18 years is a long time to serve. Anything that stands out during that time?
Yeah, one of the things was, thinking it was a hospital ship and how was I going to fit in? And because I came from an administrative background, but Mercy Ships had a plan for my life. 24 years later, I'm still here. And so going and serving on board the Anastasias, I did that for 10 years. And I served in the discipleship training school. We had a school on board that we were basically training young adults to go out and serve in missions. And so I did that for 10 years. And then when we retired the Anastasias, then I was moved over to the Africa Mercy, where I served almost 8 years. And that was an amazing role. I served for 5 years as the advanced team leader. So I'd go ahead of the ship and live in that country for 4 months and work with the government. And I really loved that. And then for the last 3 years, I was protocol officer, events coordinator, and assistant to the managing director. So my role was very much as liaison with the governments of those countries, and liaison between the ship and the government, which was a wonderful role. So in terms of the Anastasias, when I first joined, we used to only do 5-month field services. So we would do 5 months in a West African country, and then we would do 5 months in Europe. So I had the best of both worlds because we would do our public relations in Europe. So I got to tour all of Europe, which was fantastic. But with the Africa Mercy coming online, we changed that to 10 months. So 10-month field services in a West African country, which is much better for us because it gives us longer in country, more time to do surgeries, more time for rehab, and more time for medical capacity building, training and mentoring of medical professionals. And it means that the media can then fly into those countries and then see us in action, which wasn't possible when we were doing PR trips in Europe.
And in terms of moving now into your current position as the National Director, obviously Mercy Ships is a success. What do you think makes it so successful? What is the blueprint that is being used?
You know, one of the things in joining the ship was, for me, seeing the unbelievable suffering. You know, to see people with these huge benign tumors that grow on their necks and their faces for decades and decades, and causing them to be outcasts in their communities. And often they die from them. And they're not cancerous. They are tumors that grow out, and as they grow out, they grow down and cause them to suffocate. It's a horrendous situation to see so many of these in Africa, and the tiny malnourished babies who can't get fed properly because they have cleft lip and palate, and the trauma of children and adults who have terrible burn contractions because they weren't able to get help when they got so terribly burnt. Let's not talk about the millions and millions of people with cataracts. It's a 30-minute surgery, and yet people live with these for most of their lives, and without Mercy Ships, they cannot get the surgery, as well as all the other surgeries we do. So knowing that there are more than 5 billion people around the world who cannot get access to safe medical care, and that only about 6% of operations are actually done in the poorest countries, it makes sense for us to have hospital ships that give us the flexibility to bring first-class medical care to the developing nations. So to those who otherwise would not have access to these types of surgeries, the conditions that we treat are because of abject poverty. That's the only reason we see them. Millions of people in these countries, they do not have access to medical care, either physically or financially. And without Mercy Ships, they have no way of getting these care. Sometimes our ship is the only facility in country that has an X-ray machine or an ultrasound.
So, I mean, that begs the question, shouldn't we have more of these ships running around the world administering help to communities? Absolutely.
It is honestly one of the most unique ways. And Don and Dion Stevens founded this Mercy Ships in 1978. And for the past 40 years, we have been following a very unique model. So we operate solely on donations from corporates and individuals. And we are very fortunate to have people all over the world who support us. We have 16 national offices around the world. We have an African office in Benin. And we all have the same task. We raise funds, raise awareness, and raise crew. So we rely on volunteers, both medical and maritime professionals, as well as all other crew that we need to run a hospital ship. If you can imagine the ship as a hospital, so we need our medical professionals. As a ship, we need maritime professionals. And then as a community, so we need people in the galley and housekeeping, etc., etc. And every year we have around 1,200 volunteers representing 60 different nations who come and serve with us. And we have crew who serve from 2 weeks to years and years. Dr. Gary Parker and his wife, who is the chief medical officer on board and maxillofacial surgeon, they've been serving over 30 years full-time on board right now. So everybody comes, no one's paid, everyone's a volunteer, everyone raises their own funding to serve. So with the donations we get from corporates and individuals and the crew, it enables us to offer free medical surgeries to the poorest of the poor, regardless of sex, race, or faith. Everyone is welcome. And so with that in mind, yes, it makes sense to have more ships providing this.
And do you have to turn away volunteers? Is it that number of people that are interested, or do you struggle to get the volunteers?
We're actually doing really, really well. We are mostly fully staffed. There are some specialities that may be difficult to find, but with 16 national offices, we are usually able to track someone down. So, for example, here in South Africa, I have a list of doctors who serve on board. And when we're in a pinch, we can always contact them and ask them if there's any way they can serve for 2 weeks or 1 week, even if it's a need. So we're always on the lookout for crew. We've got 2 ships now we have to crew. On the Africa Mercy, we have space for over 400 crew, and on the Global Mercy, 641. So it's a lot of volunteers. So we're not there yet. We have a lot of applications, and they're coming in all the time, but we still need more. So we love to see, but from all areas, maritime, medical, and general crew.
That actually sounds like a logistical nightmare to me. So if you've got people serving for as little as 1 week and 2 weeks, trying to manage that, it sounds like you could be a crew manager for any major shipping line with ease. Anyway, the new ship, the Global Mercy, due to come online next year. I mean, she looks wonderful. We're actually going to do an onboard feature in the next issue. I see there's some quite sophisticated equipment going on there. And from what I could see, it looked like you could also possibly do remote surgeries. Is that true?
Yeah. So, obviously we've been in West Africa. It's we can't do all our services on board. So, for example, when we take a biopsy, we have to send that via internet to our partners overseas to give us a reading of that. So the Global Mercy will be able to serve us in a lot of new different ways in some of these areas. So with the online of the new ship, we can definitely double our capacity. We can do so much more than what we're doing right now. But also what's unique with the Global Mercy is that we've created a platform to do a lot more medical capacity building. It's very, very crucial to us that we are training local medical professionals to do what we're doing. And we have a great story. When we were in Guinea last, we only got 6 cleft lip and palate babies. The time we'd been there before, we had so many babies, 600 children with these cleft lip and palates. And here we are in Guinea again, a number of years later, and we've only got 6 babies. And we asked, where are the babies? Only to find out that the surgeon who we had trained had done 385 surgeries before we arrived. So we know that it's so crucial for us to do this training of and mentoring of these doctors and nurses. So we'll have a lot of ability to do that online too, which is what we're doing right now. While the ship is not in Africa, we're doing a lot of training and mentoring of these medical professionals in these West African countries through online services.
What has the impact of COVID been for you?
Yes, it's been complicated, of course. The ship was in Senegal when the lockdowns began to happen. And so we had to bring the ship out of Senegal. We took her to Spain, to Tenerife, to an island there. And all our medical crew went home and served in their own local hospitals, fighting COVID in their own countries. So we took advantage of the ship being in Spain, and she's getting her annual maintenance right now, which is great. The ship has remained COVID-free, and we're very, very grateful for that. So it has kept us out of Africa, but our plan is to go back in April next year. So that's what we're working towards. But in the meantime, we are providing PPE to countries along in West Africa. We're providing funding, helping with the dental clinics that we've set up in Guinea, as well as doing online training with the medical professionals in those countries.
Okay, so now we're sitting almost in November. There's not much time left for the rest of the year, but if I could ask you your one goal for the remainder of the year, what would it be?
Well, I know that Mercy Ships International have their own many goals, but me personally, as Mercy Ships National Director in South Africa, my goal before the end of the year is to be able to get a commitment from the health minister here in South Africa to do some projects in South Africa. My heart has really been touched by the plight of the poor in South Africa, and we typically focus our attention along the west coast of South Africa, but we realize that there are some things we could possibly do. So my goal before December hits is to have some kind of commitment from the health minister that we can provide some services. There will be limited medical, maybe some training right here in South Africa next year. So that's my goal. That's what I'm working on.
So we'll hope to see the new ship come visit then.
Oh, that new ship will definitely be here. We're hoping to see the Africa Mercy 2021, but yes, the new ship as well. We're looking forward to that at some point. Yes.
Awesome. Thank you so much for joining us, and well done. And there's not much you can say to someone or to an organization like Mercy Ships, but keep up the good work. I mean, it's great. And may the next year be fulfilled and the donations keep coming in, and we'll speak to our crew and say, get on board.
Thank you, Colleen. Thank you so much for having me on your show, and I really much appreciate that.